Hello everyone. Today we will discuss about Gumma. Gumma is a chronic granulomatous lesion seen in tertiary syphilis, occurring years after the initial infection with the Treponema pallidum. It reflects a delayed hypersensitivity reaction, which is an immune-mediated reaction, and it is not active bacterial proliferation. It occurs due to host immune response to persistent treponemal antigens. An organism load is very low or absent in the lesion, represents a form of type 4 hypersensitivity reaction. It is firm or rubbery nodules. A cut section shows central soft necrotic gummy material. In the microscopy, there will be central coagulative necrosis surrounding zone of epithelioid cells, plasma cells, lymphocytes, and peripheral fibrosis, endarteritis obliterans in adjacent vessels. Skin and subcutaneous nodules are the most common site for ulcers, followed by palate and nasal septum, where there can be perforation and collapse of the nose. Tongue may mimic carcinoma, and in bones, especially in tibia and skull, it will be present with deep pain or deformity, which is called as Faber-Shin. In testis and breast, it is rare but kind of relevant. The clinical features include long-standing painless swelling with a gradual breakdown of forming punched-out ulcer, and ulcer characteristics include sloughing necrotic base, indurated margins, and minimal pain and discharge. Palatal lesions like a nasal regurgitation of food or altered speech may present. In the bone, the lesions may cause nocturnal pain, swelling, or deformity. The differential diagnosis includes squamous cell carcinoma, tuberculosis, actinomycosis, chronic osteomyelitis, and fungal granulomas. There should be a high risk of suspicion in chronic painless destructive lesions, followed by serology tests such as VDRL or RPR for screening, confirmation through TPHA or FDA ABS, and the biopsy, the granulomatous inflammation with plasma cells will be seen, which will help out to rule out malignancy. In the imaging, lytic or sclerotic changes might occur. Medical treatment is primary, that is benzazine penicillin G, which is a standard for tertiary syphilis regimen. Alternate for penicillin allergy patient include doxycycline under supervision, and the surgical role include diagnostic biopsy, debridement of necrotic tissue, and reconstructive surgery after complete healing. Excellent response to penicillin, and usually lesions heal with the fibrosis, and structural damage may be permanent if treatment is delayed. So the key exam points include it is a lesion in the tertiary syphilis gamma, and it is immune mediated reaction, which is not an active infection but type 4 hypersensitivity reaction. Treponema are scanty or absent in the lesion. A central coagulative necrosis is characteristic. Plasma cell infiltration is the key histological figure and commonly affects palate, skin, and bones. Lesions are usually painless with a slow progression, often mimics carcinoma, especially in the tongue and palate. Penicillin is the treatment of choice, and surgery is mainly for diagnosis and reconstruction and not for cure. Hope you have learnt from this presentation. Thank you for watching.